I'd like to discuss the knowledge and to action cycle in regards to influenza vaccination mandates for healthcare workers. This hits home to me as I live in BC, which is the first province to enforce healthcare worker vaccination or masking during the winter season. I used the PICO format to formulate assignments 1 and 2 with my population of interest being the healthcare worker. My PICO question was, among healthcare workers, does influenza vaccination prevent virology-confirmed influenza and reduce absenteeism? Using the evidence hierarchy, the best evidence I found to answer this question was a systematic review conducted by Eng and Lai from 2012. The review found there is no definitive conclusion on the effectiveness of influenza vaccinations in healthcare workers because of limited numbers of related trials. Further research was necessary to increase confidence in the vaccine. For assignment 3, I also added the Cochrane review by Thomas et al. From 2013 to explore the effect of healthcare worker vaccine on patients. The Cochrane concluded there was no evidence that vaccinating healthcare workers prevents influenza in elderly residents in long-term care facilities. Interestingly enough, our government does not provide us with RCTs from acute care settings where most of us work. Both reviews were graded by the folks at McMaster University's Health Evidence Database System, who reviewed them as strong with ratings of 9 and 10 out of 10 respectively. What do healthcare workers think of mandatory programs? Pitt et al. Conducted a systematic review that found 75% of healthcare workers, regardless of whether they voluntarily vaccinated or not, found mandatory programs coercive. Yet the media and our public health officials have strong words for healthcare workers who oppose these mandates. Those who disagree with the flu vaccine are accused of harming patients. They are called stupid, reckless fools on academic websites like Medscape and continually berated by the media. This derogatory attitude permeated our workplace last year when one of many of our brightest clinical skilled nurses who elected to wear the mask instead of vaccinating were bullied and harassed by a handful of aggressive coworkers and patients. I was scared to speak up for these coworkers for fear that I would be labeled an anti-vaxxer who didn't care about patients, and I felt very badly about it. This year I want things to be different. On November 27th, I conducted an in-service on our unit using the principles from the OLOIS bullying program that endorse open discussion of respectful workplace expectations in a group setting. The in-service used the theoretical framework of Bandura's health model to explore the variables which affect our coworkers' choice to vaccinate. We explored how variations of knowledge, perceptions of bias, external cues from the media, and personality all affect our health choices. We wanted to illustrate that nurses who don't vaccinate are guided by quality evidence. It doesn't mean these coworkers don't care. They are simply not compelled with the evidence they have been provided and the management of influenza in general. They want better conducted studies, and I think our systematic reviews have also spoken to that. But unfortunately, our academic conversation has been silenced due to mandatory programs. The in-service went over very well. It helped hold a mirror to the bullies and give them insight into their behavior, and I think it worked. It gave credible voice to the conscientious objector as a healthcare professional who critically analyzes his or her decisions on evidence-based medicine. Thank you.